Good evening, ladies and gentlemen, and welcome to the second Recovering Community Buildings webinar with us here at Kirklees Council. I'm really pleased to be joining you again today. It's Tuesday, the 8th of September 2020, and we've got a great panel here for you. Exactly the same as last time. If you've got a question or any concerns, if you'd like to stick them, type them in on YouTube, we'll be able to get to them for you. It'd be really great if you could put your name and perhaps the venue that you've got any inquiries about, so that we can come back and give you some real feedback. If you're watching this on playback later and not the live event, please do get in touch and we will try our very best to answer your questions. Exactly the same as last time, we're going to go through a bit of a panel update around some things that we know. We've got some brilliant experts for you here today and some people who've really opened their community buildings up and are starting to embrace some of the challenges that COVID's presenting for us. And then we've already got some questions that have been asked earlier, and I'll turn to them and obviously any that are asked in the chat as we go forward. So I'd like first of all to ask Jill Greenfield to introduce herself. And Jill, could you give us a little bit of an update as what's happening out in the community and our response to some of the things that are happening across Kirklees at the moment?
Certainly. Good evening. It's really great to be here. And it's really important that we can work alongside our community organisations and buildings in terms of supporting our communities to be able to protect our communities against COVID. Some of the work that we've been doing is working with our cross-council teams and our partners to provide visible reassurance to communities about how to stay safe and supporting them with ideas and activities as well as the very key information about how to do that. I'm sure that you will have been engaging with our teams over the last few months, and really when community buildings are opening, we really want to work with you closely so that we can really further how we can build that community resilience to COVID. Thank you.
Thanks, Jill. Jonathan, I'd like to ask you to speak next. Emma was here last time, so she's a pretty tricky act to follow because she came armed with lots of risk assessments and lots of really good information, which I know colleagues found invaluable.
Thanks, Joanne. Yeah, pleasure to be on tonight, and I'll do my best. So my name's Jonathan Quarmby, and like Emma, we both look after council buildings, including community buildings, from a facilities management point of view. I'd really like to just try and keep the message really simple for you, first of all. And I think for me, the starting point is to really start with the end in mind when you're running a community building. So work out what it is you need to do and what your priorities are when you're coming to think about opening a building. You might have a building where it's impossible to get all of your normal users back into the actual community building in a COVID compliant space. So you need to start with, well, who are your priorities? What are your priorities? Once you've worked out your priorities, don't forget you almost need to do 2 risk assessments. The first one is a COVID building risk assessment. And I think Emma went through that the last time in some of the things that you need to look out for. But really look at that first and make sure that you're happy with it before you then do the service risk assessment or the activity risk assessment. And the activity risk assessment you need to do with the group that are coming in so that you can be sure that they're going to apply your building risk assessment to their activities and the two will mesh together really well. I think the other things that we've been learning as we've been doing it as a council is don't be surprised how much space you need for storage. The amount of stuff that you've got to take out of some of your rooms to make them a COVID compliant room means that you've got to put that stuff somewhere. It could be crockery, it could be tables and chairs. It's amazing where you've got to find places where you can safely store things. And the other thing to remember is don't forget, this is not just about COVID. Remember all your other health and safety as well. So make sure that your fire safety stuff's up to date, your water quality stuff's up to date, and all the other type of risk assessment stuff like electrical safety and gas safety before you even think about inviting groups back in. And I'd like to say it's as simple as that. And it is when I say it as quick and as loud and as simple as that. But I appreciate it's a complex area. So don't forget there are people out there that can support you. Thanks, Joanne.
Thanks very much, Jonathan. Donna, I'd like to turn to you now. Obviously, there's been such a lot of things happening with local restrictions and that. I expect people are quite confused at the moment as to what they can and can't do and what's a face covering and what's a mask. So from an infection prevention control perspective, could you give us a little bit of an update?
Yeah, good evening, everybody. It's lovely to join you all. In terms of things new around principles around infection prevention control, obviously the messages still remain about being observant around signs and symptoms of COVID, and to ensure that anybody that's symptomatic doesn't attend work and keeps away from public spaces, and ensuring that they keep to self-isolation guidance. So in essence, we're still observing for people with high temperatures, people that might have new or continuous coughs, a loss of or change in taste and smell, and that might be quite mild for some people as well. So IPC guidance really is around making sure that we're still adhering to those key principles around hand washing before and entering a community setting and after leaving, and actually washing your hands on a regular basis whilst you're within that setting as well. Avoiding touching surfaces and regularly ensuring that we are socially distancing to 2 metres as far as practically possible. I think the IPC team have continually learning on a daily basis as a result of working with other services and people sharing their experiences and exploring new ways of working and managing difficult situations sort of to reduce COVID transmission during this time. So we've learned an awful lot from others, and we also want to ensure that people have got this opportunity and opportunities going forward to contact the team should they need some additional support, advice, because although we know that you'll have sort of robust risk assessments in place, as things crop up over time, that robust risk assessment might need altering and tweaking, and that's something that the infection control team can very much help out with. Thanks, Joanne.
Thanks very much, Donna. Lisa, it's really great that you could join us again. I know that the Chestnut Centre's been running as a community venue all the way through COVID and continuing to deliver services. But I do know that since we last spoke, you've started to expand some of those. So how has it been?
Evening all. Yeah, it's been slow, but it's funny, this week has just picked up though, so this is quite a pertinent time to do this. Some people did request the risk assessment template from me after the last meeting, so I sent that through to them. So I hope you all enjoyed completing some of that. So we've been busier because obviously the children who were in term time have come back. So we've had to stagger the parents dropping off and picking up even more than before. We have been looking at using more exits and entrances, as Jonathan kindly clarified just before this session opened. A fire, let me get this right, Jonathan. You can open or prop open a fire exit for air to come in the building, but not an internal fire door. So that will help us a lot with different entrances for the parents, but obviously then we have to consider the safeguarding of children as well as that. We've introduced obviously face coverings for anybody coming within the building. When the nursery staff come up and greet the parents, they wear a face covering just for that short interaction. Now, we've got lots of laminated signs for a COVID room. So if someone does display symptoms, we've got a room we can set aside, a separate toilet that they can use, and then specific cleaning afterwards as well. And I think that's all the updates from our point of view. So yeah, never changing risk assessment and risk assessments and checklists as before.
Yeah, I think we said that last time, didn't we, Lisa, that actually you've not done a risk assessment forever. You've done one for today, and something will change tomorrow, and advice and guidance will change. Or, you know, like we've been discussing, you know, about needing an extra entrance or an extra exit, so that it's a very dynamic thing that needs the ownership, and you do actually need to I think run a few sessions before you work out whether or not your risk assessment does do the right things for you. And it shouldn't be something that colleagues who are listening are worried about continually changing, because that shows that actually you're continuing to learn and develop and grow and mitigate those risks. And this is not about us being able to remove everything, it's about us being able to reduce those risks. So thank you, Lisa. And I would like to say thank you for the resources that you shared. I do know a number of colleagues really liked those resources, and we're really grateful for the things that you said yourself and that you, Jamie, said as well. So on that note, I'll turn to yourself, Jamie. We've recovered quite a number of different things and had some public facing things going into your building out at the Drams Centre. How's the last few weeks been for yourself?
Good evening, everybody. Thanks for having me back. Yes, it's been an interesting period, as a few of you have mentioned. Lots of things to change, lots of things to update. You know, like you said, on a daily basis, things are changing within the risk assessment. But I picked out a couple of key things that have changed recently for us. The first being refreshments, so tea, coffee, drinks, biscuits, etc., for whether it's a meeting, conference, or a community event that we're hosting. Previously, we didn't provide that, but now we've looked at our risk assessment, looked at our processes, and we're reintroducing refreshments for those activities that are going on. And they're in kind of the barista style, so as you would experience in any coffee shops in any town at the moment, about how they're kind of controlling COVID in terms of how teas, coffees, etc., are kind of given out to members of the public. Other things that Lisa's mentioned as well, similar to the COVID secure poster, so displaying clearly upon entry all the measures that we've got in place, so that you as a member of the public, when entering, can see all the relevant controls are in place. Similarly, the face coverings as well, so that we've made that mandatory within our buildings as and when you're walking around or attending any sessions. One of the questions I know that's come up before was in relation to social distancing and whether it's 1 or 2 metres. At the Dram, we're still adhering to the 2 metre rule throughout all our activities that we're delivering. Another thing that we're doing as well, particularly both for internal and external bookings, is requiring that the risk assessment is provided by the hirer, so we know what controls they've got in place in terms of COVID, and making sure that they match what we've got in place in terms of the building operations as well. Finally, one of the outcomes from the last meeting that we had was in relation to a kind of a video tour of the Dram and all the different controls that we've got in place. That's more or less done and should hopefully be released in the coming weeks.
Right, that's great. I know that that'll be really useful for colleagues in helping them understand how you'd walk through a building. So it's really great to hear that that's going to be out in the next few weeks. I can see that Tamsin is typing at the moment some questions in, so I'm going to start to turn to questions and bring colleagues in as and when they can support us with those. So the first question I've got is something that was posed to us earlier, and I do think, Jamie, that you've actually got some experience of this. So Maeve at the Destitute Asylum Seekers in Huddersfield has got a set of circumstances where they're doing some face-to-face work. They've got a risk assessment. They're really comfortable with that risk assessment, but occasionally the service users attending perhaps with a child, and they're wondering what they need to do about that. Now, I do know, Jamie, that you've come across this. Have you got any advice and guidance?
So we're working with Wakefield Council in terms of some family contact sessions, so a similar sort of nature to the one that you've mentioned. From our perspective, it's about maintaining that social distancing, maintaining your test and trace data for the 21 days to make sure that if you do any outbreaks, you can trace that back, and cleaning down the rooms prior to and post use. So nothing specific for that type of meeting, but just reiterating what we kind of already do for a normal meeting.
Yeah, I don't think there's anything particular, Donna, is there, that if a parent or somebody's bringing a child with them, we just need to follow the normal sort of things.
I think if we can, we could encourage perhaps children to bring their own toys and certainly not provide communal and shared toys at that point. Yeah.
Yeah, absolutely. So that should help you, Maeve, with that. Just note in the comments that Paul from the mission has started to reopen. I've noticed that, Paul, because I've noticed on Facebook that you've been actually posting. I think it was beef stew was available and pizza yesterday. So that's great to know, because I know it's a wonderful resource that a lot of people who live in and around the town centre or depend on those services for that personal contact and that mental well-being will have greatly missed. But yeah, great to see that your cafe is open. Obviously that takeaway perspective, like Jamie was saying, you don't want to be washing things up, you want to be handing things out. I think we all recognise that for a number of community organisations, the sale of refreshments provides that real boost to some of your income, particularly for hirers and things like that. So it's important to be able to get back for that. And I also note that Paul's mentioned about the fire doors. It is something that we were chatting about just before we came on to this webinar, that actually if you do have some internal fire doors that have automatic retainers such as maglocks, you can also have those open because they will shut. But a number of our community venues probably don't have that, so that the advice and guidance is you can open an external door, but you need to be careful about security, but you should keep your internal door shut unless you have a sophisticated system with that. So we've got a question now from Charlene from the Jubilee Centre. I do remember that Charlene was on the third sector call the other day, or at least another colleague of hers from the Jubilee Centre was on that call, and she's mentioning about singing. And is singing now permitted in particular areas, and that people like joining in? There's some specific guidance, Charlene, that the government has put out around singing and places. It comes under the safe use of places for worship. So sometimes you've got to look, particularly for community venues, I think it's useful to look at both that guidance, so that's the safe use of places for worship, and the community venues guidance, because they sometimes have things that cross-cut each other. There's a particular section in there around singing and chanting and the use of musical instruments. And we had a little bit of a chat as a panel about this just before we came online. It specifically says small groups of professionals or non-professional singers can sing in front of worshippers both indoors and outdoors from the 15th of August. So from now you can do that. Please do remember though that that gatherings of more than 30 are not permitted outside in Kirklees at this moment in time. Singing in groups should be limited to a small group of people and should not include audience participation. So from that perspective, Donna, I would envisage that if you've got a choir and it's a small choir and they're singing, they can sing, but the congregation shouldn't be joining in. Is that the right inference to take from that?
That's absolutely the right information to give, Joanne, around that. I mean, in some circumstances, it's recommended that sort of audio plays used in places of worship, and obviously to minimise that audience participation.
Yeah, and I think what we can also do is take that guidance as well. And if you've got a group, some of you will have groups who are wanting to come in and do choral practice or orchestra practice. Again, if your space fits those numbers and they conform to what is known as a small group, and that is, I understand it's open to interpretation, then that can happen within your venues. And again, it's back to those things that Jonathan, Lisa and Jamie have said again this time. It's the amount of people you can fit in your space, and they can then rehearse and sing for that, because I know we have had another question on that. Lisa, have you had any inquiries about that sort of thing?
I was just going to say, because I think Charlene might be referring to the, so it's toddlers and mums singing. Is it Melody Makers? I think I used to attend many moons ago. So from that perspective, if there's 10 mums or 10 parents and carers and 10 children and they're all singing together, so they're not singing to anybody, is that okay?
I think I would class that as being that they were almost performing for themselves, and
Yeah.
provided they fit within the space. There's particular guidance where you've got a group of people who are singing and you've perhaps got an audience, and that audience could be a congregation or whatever. It's section 4 of the worship guidance that I think is helpful, regardless of whether it's actual worship or not, you're doing from a singing perspective. So I would imagine if the space allows that a number of people in for that activity on the 2 meters social distancing, that would be okay. Okay, so our next question is from Alison at the Jubilee Centre. So she said, are we able to have sessions that are classed as social gatherings as opposed to services or entertainment? And that's a bit of a tricky one, really, because actually when you're a community venue, you are actually providing a service. A social gathering would be something that you would do in a different area, particularly. I think what I'm struggling to understand is why you'd want to call it a social gathering, because you don't get any more people in your space from a social gathering, you know. So you could hire your hall to 20 people to come for a social gathering, but you'd still have to have the right amount of space to be able to do that. I don't know if anybody else, Jonathan, could you think about, I don't think there's any advantage for it being a social gathering versus a service or entertainment.
No, the size of the space determines the maximum number of people you can fit into that space based on social distancing. So it doesn't have any impact at all whether it's a social gathering or not. Yeah.
So exactly that. So your space is key. Again, there's been another question popped up about singing together, and I think we've answered that. So I'm going to assume that question's okay. So then there's a question around what's the difference between a faith building and a community building, and when does a faith building class as a community building? And this is where I think you've got to perhaps read both sets of guidance, but essentially I think it's just about space. I'm looking at Jamie and Lisa. I don't think there's any advantage at all to defining yourself as one or the other.
Not from our perspective. The guidance seems to be the same. So to repeat Jonathan's comment around space, it's looking at space, access, egress, all those factors to make sure that you've got the appropriate amount of space for social distancing. Yep.
Absolutely. And then there's been a question about bubbling people. Is this for people that meet every day, or would this include groups that only meet for once a week for an hour? So bubbles are quite complicated, aren't they, Donna? We've been working over the summer period with schools to understand about bubbles. And I have a very simple way of thinking about bubbles, which is helps me. Bubbles are not to keep you safe. They're to help you close down that activity and understand who may or may not, if you get COVID, have been placed in a situation of risk. We would always suggest that you should use social distancing for anything that's happening. However, in Lisa's nursery settings, no doubt they'll be using bubbles, won't they, Lisa? And that's appropriate because those children are attending that those sessions, aren't they? Do you want to explain a little bit? I know it's run on your site, Lisa. Do you want to explain a little bit about the difference between a setting running the bubbles because they're regularly taking people and a hirer?
Well, so obviously our nursery manager does all that, but yeah, so they have the morning children, the afternoon children. They're all split into different age groups anyway, but whereas they might have done some activities together, obviously that no longer happens. As far as bubbles for groups, I mean, we've got a social group which we would have to halve the size of, so we would just do it every other week. We're looking at doing it every other week and keeping the same 6 or 8 people together every other week. It's just deciding which 6 or 8 are going to be together.
And that's where you're providing a particular service, isn't it, yeah. Lisa? I think if you've got somebody who's coming in to run a Zumba class or something where they're running that and they're hiring that out on a sessional basis, that they should be understanding who's coming to those test sessions, and from a test and trace perspective, taking a register of those sessions every time it happens. Where you're regularly delivering giving a service to the same group of users, then it would be important to ensure that they're in bubbles to help support keeping everybody safe and being able to close down appropriately if there's a risk of COVID. So I've now got a question around cleaning toilets. So I'm warming you up, Jamie and Lisa. I'm going to come to you on this. So there's a question going, in cleaning down equipment, does this also mean toilets? And what is the advice on regular toilet cleaning?
Do you want me to go in, Lisa? So at the DRAM, we've got our daily cleaning regime around toilet cleanliness, which we have increased slightly just because of what's going on in relation to COVID. But the main focus for us throughout the day is increased cleaning of touch points throughout the building, but that also includes toilets. So door handles, sinks, taps, corridors, anything that people touch on a regular basis throughout the building is cleaned ideally 3 or 4 times a day, depending on the usage that we have. But that's the focus for us at the moment.
Lisa, is there anything you want to add for that?
No, we do the wiping, and if we have a particularly busy day, we do bring some contract cleaners in for an additional full clean. I suppose it's not looking at it as toilets, it's looking at all the regularly touched surfaces should be wiped regularly. It's not just about toilets. Can I just say as well, with regards to, I know it's totally off point, but hand dryers, because we've turned all ours off and resorted to paper towels, but whenever I go anywhere else, nobody else has theirs turned off. So
I think ultimately paper towels are, the sort of blue sky standard that we'd like everybody to use, but we understand that it's not always possible to install paper towel dispensers.
So paper towels are better. Drying your hands properly is always important, so using the hand dryer otherwise. There is obviously a significant cost and an environmental impact to the paper towels, which I'm sure if Emily was here she'd want me to mention. We've got a few questions. We've got quite a big question about a particular dance school that's quite complicated. So Tamsin, if you remind me, I think that needs a proper answer afterwards because it's quite a technical thing. So we'll do that via email after. It's around class sizes and all sorts of things that's quite complicated and specific, I think, to that. I would just like to mention though, and both Lisa and Jamie, you have the slight luxury of being able to facilitate cleaning in your own buildings using resource. And I am aware from the voluntary sector meeting that myself and Tamsin were on the other day, there are a considerable amount of groups where it's one group in and another group back out again. So in that instance, I would expect if you're hiring the room out to somebody that you give them the clear responsibility of cleaning that, and you give them a tick list about what they should be cleaning. And for the next hirer, you give them the same list and expect them to do a pre-clean beforehand, never assuming that other people have done that, because I do know that not every community venue will have people who are able to do that. It will be an expectation of groups to do that themselves. So there's another question about singing groups inside or outside. Again, I'll just reiterate, you can sing outside, but not more than 30 of you. And do be mindful, if you do attract a crowd, you need to think about how you're going to deal with that. And inside, as we've already touched upon, it should be a small group of people, not singing to a larger group of people, and just the size of your space matters. We've got a question again, and I think it's probably worth, Jonathan, if you just give a little bit of explanation as to how people would work out their space. So this is a question from a parent and toddler group that go, how many people are we allowed to meet in as a group? So could you just explain how would they go about working out their space?
Ooh, thanks for that one, Joanne.
You're welcome.
Start off with the space that they're going to occupy, and you need to just measure the area of that and then divide it so that everyone in theory in that space has got 2 meters separation so that people can socially distance. That's the most simplistic way of looking at it, but you do need to think about how they're going to access that space and how are they going to exit that space, and also what they may need to do in the event of an emergency. So you could have pinch points in corridors or stairs leading up to that space, which might limit the numbers further. So it is looking at the building as a whole, not just as the final destination space. And you've got to go with what your lowest limiting factor is. There are, as Joanne mentioned earlier on, mitigation factors that you can put in if you can't achieve 2 meters social distancing in communal areas, such as wearing masks or face coverings rather. And those can help if those interactions are transient. So 2 people walking past each other on a corridor, for example, for a very brief period of time, wearing a face covering, doesn't need to be 2 meters apart. Other limiting factors are obviously lifts. They are very much a 1 in, 1 out. Toilet facilities, very much a 1 in, 1 out, unless you've got a luxury of space in your toilet facilities so that people can still socially distance. And then the number of wash hand basins or sanitizing points that you've got would, I think, limit the numbers to a building. Things that you can do to mitigate some of those issues are around staggering start times, as Lisa's mentioned. That's a good one to help just with the flow around the building. One-way systems as well, if you can achieve it, so 1 way in and 1 way out. They're all factors to consider to help drive up your numbers, because I appreciate in community buildings, one of the big things that you're trying to do is obviously drive an income so that you can continue to run as a community building. So what we're trying to do here is give you the tools or give you some hints and tips as to how you can drive up your numbers, but do it in a safe way, and a safe way from a COVID point of view, and also any other health and safety respect as well. I don't know if that covers it.
Yeah,
Joanne.
I think it does, Jonathan. Thank you for that. So, excuse me. That's really good guidance about how to look at your space. I think so that's one of the things you need to do, parent and toddler group. I don't have your name, but the other thing that you need to do is get in touch with Kirklees Council's early years service, and we'll make sure in the follow-up from this that there is an email link for that. There's some real specific guidance around running early years settings. Nobody expects toddlers to be socially distant at any point in time, but so there are some guidance around how to set things out and how to work that through, and they've got some invaluable support and tips around that. So thank you, Jonathan, and we'll bottle that, how to measure your space and work it all out, because it is something that we keep returning to, because obviously everybody is really struggling with that. Donna, we've got a question for you now around people who were previously, well, still probably are classed as clinically extremely vulnerable and were shielding. So there are a number of groups that have got people who were in the shielding category. Obviously, shielding ended at the beginning of August. And these groups are wondering, do they need to put any additional precautions in for those people attending? What should they do around face coverings for the wider group and things like that? Have you got any guidance if groups have got people who were previously shielding attending?
In terms of face coverings, that's completely up to that individual, whether they feel more comfortable in that environment wearing a face covering. And I guess really it's dependent on that client's underlying health conditions to how they've coped previously, and the amount of time that obviously we understand that they've been isolating for. But in terms of any additional precautions, the precautions really remain the same in terms of ensuring people are washing their hands on a frequent basis, socially distancing, and obviously ensuring that the environment that these people are in remain clean.
Yeah, absolutely. And there is something as well about individuals taking personal responsibility. I mean, obviously, if you're delivering a service to a vulnerable service user, then the responsibility is on you. But if they're attending something that you're setting up and attending that, they need to take some personal responsibility to keep themselves safe, which may mean that they take a decision to wear a face covering in a setting where other people are not necessarily doing that. But obviously there are the benefits that people are getting back to some aspect of socialisation. So we've got a question here and we had a very similar question on the third sector webinar the other day, which was making groups smaller and spending longer on cleaning and purchasing extra cleaning and protections is going to mean that we're not financially viable. What should we do? Lisa, I'll bring you in about some of the challenges you've faced in a minute, but I do know that if you are not already linked into the third sector leaders and support group, then you need to be. There are a number of specific grant fundings and things like business rates relief and a whole host of stuff that you can access as a community group, and they can help you ensure that you're accessing everything that you possibly can at this moment in time. Lisa, how have some of the people that use your facility been dealing with these financial challenges?
Exactly what you just said. You stole my thunder. Oh. Yeah, accessing. I mean, we're lucky at Focal. We've applied for a grant, so we've bought lots of PPE, lots of sanitizer and hand towels, so we can supply the groups to that. We're looking at maybe subsidising some of their rent if we possibly can for a period of time while people build back up if they can, and looking at installing maybe a screen so that they can have some people online and some people inside the building, so inside and outside. The ones online would pay slightly cheaper, but it's still a bit of income coming in. So that's where we're at the moment. That's all we've managed.
Yeah, I do know that the community centre that's my local community centre has asked users to pay an additional voluntary contribution to just to keep it going, and there are those things, but obviously it just depends on the type of service you're delivering, on the type of use and what particular area as to whether or not that is. But third sector leaders are an absolutely brilliant resource, and we'll make sure that gets in there. There's lots of grant funding. Val from Third Sector Leaders was explaining the other day about how if you're targeting some of the groups and activities that come to yourself to support things like social isolation due to COVID and things like that, there is funding available for you, and that can help support you at this moment in time. So please make sure you get in touch with those. Then there are a couple of questions which obviously the success of everybody last time in saying here are some risk assessments, Donna offering wise advice and guidance, Lisa with her templates, and Jamie with the video. Everybody's going, can we have a little bit more of that? So a couple of questions people have said, we're not health and safety experts, can somebody check our COVID risk assessments? And the other one was around where do we get some support from infection prevention and control? One of the things that I would say is that regardless of whether somebody checks your COVID risk assessment, it remains your responsibility as an organisation to own that. So however you're governed as an organisation, you have to own that risk assessment, and the users have to own theirs, as Jonathan explained earlier. We do have a wealth of knowledge across the community of people who are getting this right in difficult circumstances. So what I would say to you is if you drop us a line, we will put you in touch with other organisations that are getting this right. The other thing that we're going to do is, and myself and Donna talked about this before the webinar, is we're going to send you some example ones out to show you what a good one looks like. And if we could perhaps send a couple out, Jonathan, around a couple of risk assessments, so we can just say this is what a good risk assessment looks like for a building, and this is what a good risk assessment looks like for an operation, to give some people some support. And we'll work through with that one. So it's a difficult one for us to point you at an individual, because if I said, yeah, Donna's not busy, she's at the end of the phone, she would kill me, because as you can all imagine, the schools have gone back recently, and we're all continuing to work to support those many and varied services that Kirklees Council and its partners deliver with a very small team. But what we will do is we will put you in touch with somebody in your community that can help you and support you with that. And I think, Lisa, you might be able to help with some of that, mightn't you?
Oh, sorry, I was just reading the chat.
So you might be able to help with supporting people who are struggling with the risk assessment.
Yeah, definitely. We've got some funding, so we were thinking along the lines of, do the building and the group and the users in the building want to come together, or do they want to bring some pictures? Do they want to go online and have a chat and keep it really small and really practical, because each building is so different, has different equipment, different facilities, different users. So yeah, we have got the capacity to do some of that, and then we can get down to the real detail, because I think that's what's sometimes missing.
That's a really great offer, that, Lisa, because actually people seeing how it's been done will take the myths busting away from this. The thing I would say, and I've said this on a number of the webinars that we've done recently, is your risk assessment is only as good as the minute you've wrote it. It will continue to change. As we know, government advice and guidance changes fairly regularly, and the situation that we find ourselves in. So we've just come out for some parts of Kirklees from local restrictions, whilst other parts of Kirklees remain in local restrictions, and that does place some distinctions on what you can and can't do. Helen from the Game Changers Fit and Fred in Field Head project has asked if we've got some similar guidance for other age groups apart from early years. There is guidance, and we're for other groups, and certainly if they're attending activity-based sessions that are very similar to holiday clubs, Helen, then I would encourage you to get in contact with the early years service, because they also support the before and after school clubs and the holiday clubs. But as well as that, there are other organisations such as Conscious Youth that are out there and working within the communities and delivering sessions to that target age range. So we'll try and find somebody that we can buddy you up with to be able to pick that one up. So if you just bear with me a second while I scroll back to the questions at the beginning. So Ibra Hussain from Thornton Lodge Action Group. I remember you were on last time, Ibra. When's building walkthrough is going to start? We want to use the Thornton Lodge Community Centre, and when can we start hiring the centre again and start activities? Jonathan, is there anything particular about Thornton Lodge Community Centre that we need to be mindful of?
No, we've got Thornton Lodge on a list of 3 other community centres that we're looking at next. So I would imagine, Ibra, it will be the end of October at the latest when we will have that building COVID compliant, ready for you to start occupying.
So there's a really good target date for you there, Ibra. So what we can also do is you, alongside that piece of work, can start to think about how your hirers would be able to come back in and you'll be able to start activities. I've just trailblazed for Conscious Youth, and Sophie's asked a question. Hi, Sophie. Lovely to read that you're actually watching us at this moment in time, and you're starting your youth club sessions in 2 weeks with smaller groups, and you're concerned about social distancing and keeping equipment clean. There's some really good guidance from the school settings that we'll send out for you. Donna, is there anything in particular for a youth type group that they need to be mindful of? I do know that obviously the restrictions around social distancing and working in particular ways in schools has been very different because of the age group, and the advice and guidance that we've given out to schools around their risk assessment has been around trying to keep the children in particular groups. But is there anything else that colleagues need to be aware of?
I think it's just really adapting the current guidance and principles for schools and adapting it and using it in different settings, essentially. Obviously, we want to welcome young adults back into activities. It's really good for their mental health and well-being. And so in terms of cleaning, it's looking at the equipment that's available for that age group and looking at what they're actually using in their activities and making sure that that's cleaned before and after use. But I think we can send out some more specific guidance going forward for that particular setting.
Yeah, we can do, and I do know that Alison, who works closely, Alison Milborn, who works closely with yourself, did some really good advice and guidance for the school settings about when face coverings are appropriate for children and all that. So we can share that as well with colleagues from Conscious Youth and the other youth-based settings that are wanting to return. Charlene has asked, what would a coffee morning be classed as? I think it's really a lot easier if, rather than thinking about what is the thing I'm doing, is just to think about everything being the same. So if you've got some people in your room, they're sort of in your room, whether they're doing Zumba, having a coffee, knitting natter, or they've come to do some first aid training, there will be an amount of them that you can fit in, and that'll be sort of it, really. And as Jamie has given you some advice and guidance around teas and coffees and things like that, in terms of a coffee morning, you can have a coffee morning, but you need to make sure that you've only got the amount of people in that space, and you need to take the advice and guidance around using disposable cups, and making sure that you are COVID safe in terms of giving out those teas and coffees and working that one through. So I think for everybody, think less about the specific thing and more about it being a use of space. So Charlene's asked a question about bubbles, which is, can we have as many in each group as the space allows? That's sort of right, but it depends if you're working with particular vulnerable groups. Jamie's nodding there, and I know that you work with some. We have some vulnerable users, and we do want to keep those in bubbles, don't we, Jamie?
Absolutely. It's it's to ensure, obviously, that they're safe, and as you mentioned earlier, Joanne, around if we do have an outbreak, we can close down that bubble immediately, rather than having to close down the entire building, all the users that have attended that building within the day. So it's really important to make sure we maintain those bubbles.
Yeah, so if you were running something like a toddler session or a nursery or a social activity for people for mental well-being or something like that, there was a specific activity, it would be advised that you'd have a think about how you were running that with bubbles. If you were running a drop-in for a coffee morning, and actually once I've got to 25, because that's all my space takes, nobody else can come in, then yeah, use the test and trace system and make sure you're taking accurate records of that. Lisa, do you want to come in on that?
It was going back to well, really costs and the green agenda as well. Can you not just put stuff on in a dishwasher, cups in a dishwasher, or a sanitizer? Obviously, it's extremely hot.
So I am not an expert on that, and I'm sensing Jamie doesn't feel he is either. I do know Jenny's available. Jenny, I wonder what would be the difficulties that a group would face if they were to move away from disposal to something. Jenny's just typing in the chat for me, so I'll come back to you on that in a minute, if I may, Lisa, and I'll take another question while Jenny's going to answer that for us, because Jenny's not on video, she's just on the chat. So Richard at the Carlisle in Meltham, you've been up and running for quite some time, Richard. We haven't spoken lately, so it's nice to read that you've got a question for us, which is, are KMC happy to reconsider the discretional rate relief for businesses for charitable organisations? So that is something that I'm not able to agree or not to here in this forum, but what I will do, and I'm certain that Jill will go back with me, is we'll take that back to Angela Blake, who is the service director responsible for businesses and economy, and I'll say that you've asked that question, and we'll make sure that an answer comes back for you during the next few days. So Brad's asked another question, which is around BAME communities being disproportionately affected by COVID-19. How can we respond to that? The end of October seems a long time to keep this community shut out. So this is a particular situation, Jonathan. Obviously, we've given an indication that we believe that particular community centre will be up and running by the end of October. Ibrahim's quite worried because he feels that there's been a disproportional impact on the community there, which I suspect is probably true. So how can they respond to them? So it's probably not a question for you, Jonathan, because you're busy working like mad to get those community centres back. Jill, what support can we give to groups such as Thornton Lodge Action Group, where they're saying we want to help our community, but we've not got any buildings at the moment?
Thank you, Joanne. We'd really want to work with you very closely in terms of our community engagement and community protection work in those areas. And so we'll pick up that conversation with you individually from here and connect you to the engagement lead. We're very mindful of the adverse impact upon our BAME communities and want to work really closely with you. And we'll pick that up outside of this meeting, if that's okay, Joanne.
That's great, thanks, Jill. So Ibra, somebody from Jill's bit of the world will get in touch with you and support you with that. It is good to read and know that where communities are affected, there are people within those communities that want to do their very best to support everybody. So while we've answered another couple of questions, Jenny's come back, Lisa, and it's that question about, the answer is one of human behaviour, really, and Jenny's advice, and for those of you that don't know, Jenny Freer is our head of venues, so anything that's catering, cleaning, venues management, she's your woman. So she wouldn't advise at this stage that you use dishwashers because they can have different settings, and there is the additional contact of putting things in and lifting them out and putting them onto the side that results in a considerable amount of touching of the crockery. And it may be that hand washing might not necessarily be adequate in some settings, so it removes that risk of that for you. I do know, and one of the things that I don't know if you're aware, Donna, but certainly it's cropped up in just how easily people can slip out of not using the risk assessment. Jamie's nodding there, so you can have one-way systems in place, and after a couple of days, people start sneaking the wrong way down the wrong way system. I know, Jonathan, we've talked about this in some of the buildings that we've reopened, about how you have to help people remember how they have to behave. So probably the best advice at the moment is Jamie's, which is to use disposable items. Okay, we don't appear to have any more questions, so I'll just give another minute for Tamsin to type any in. Tamsin has confirmed that we do have some more, so let me just find those. Oh, you're right, Tamsin. I do have an extra email with some questions in. Just bear with me. So one of the questions was from Councillor Lowe, which was around how many people to have in a building. Can we have 6 or 7 in a building? Again, I'd refer you back to Jonathan's excellent measure your space and work out if everybody can have 2 metres, and then you can either have 6 or 7, or you might be able to have 12 in a particular room and work that one through. And then Lisa, we had an interesting debate, didn't we, earlier about the 2 versus 1 metre and face coverings and the commercial aspect that impacts on people. And I think Donna's advice and guidance, Donna, is that we'd expect people to continue to use 2 metres, wouldn't we?
Absolutely, yeah. As far as practically we can, we should try and maintain that 2 metres distance, because actually it gives us all reduced ability to contract COVID, and the nearer we get to a person, the higher the increase of risk.
Yeah, absolutely. And do please remember, if in any context you're using a 1 metre, that is a 1 metre plus, so that doesn't mean a bit more than a metre. It means 1 metre plus additional measures such as a requirement for face coverings. Leslie, you've just put down that you sent a couple of questions to Tamsin, but you've not heard them. Just to confirm, I have read out all the questions that we got previously, as well as the live chats, apart from a couple more. So if you want to bang that into the live chat now. Tamsin will transfer it over and we'll try and answer those questions for you while we'll just get to the last few that I've got here. And then we had a big question around airflow, didn't we? Had a big debate, Lisa. One of the advice and guidance that we've given out previously is to make sure there's lots of air flowing through your building, so your windows are open, etc. And we are conscious that we're coming up to a slightly more inclement time of year, and perhaps not everybody wants all the windows and the doors open. So I know that you raised that question in particular, didn't you, Lisa?
Yes, it was just around if when you come to close the windows, does that mean that would reduce the capacity of the room? And like we were discussing, potentially you could ask people to dress a bit more warmer and put another layer on, because it really is, from what I've read, and I presume you agree, Donna, that it really is one of the most important things to keep the rooms fresh and air constantly flowing through. At the moment, it's fine. Our buildings are relatively warm buildings anyway. So we'll just keep an eye on that with regards to the risk assessment and talking to groups before they're coming back in, and take it from there.
Yeah, I mean, one of the things, Donna, that airflow is really important, isn't it?
Absolutely. All guidance is pointing to the same thing and recommending that all areas are well ventilated and that windows and doors where we can remain open to ensure that there's that airflow.
Yeah, so actually one of the things that you found, Lisa, was you found a really good bit of guidance around airflow and the 2 metre rule, didn't you, online? And I think we'll share that one round around how, you know, if you've got less airflow in your room, so you've got a room that doesn't have any windows, or you can't open and ventilate that room, what that does. Our advice and guidance would always be that you should try and ensure the maximum amount of ventilation. You might want to consider whether you can do that by regularly pausing activity and ventilating the room on a break and things like that, but do ensure that. Leslie, if you are still there, we will still hang on another couple of minutes if you want to try and type something into the YouTube chat, and then we'll be able to answer it. But I've answered all the questions that came before, and or rather I've read out all the questions that came before, and the panel have supported us in answering them, and all the ones on the chat. Lisa, did you want to particularly say something?
Yeah, just something around, because a couple of groups were asking about fans. So I said no fan, because obviously that can, you know, it helps with the airflow, but I took it as like it was a hand dryer and it's just moving the dirty air around. So we've said no to fans.
In terms of in the healthcare settings for fans, we're asking if you're going to use a fan, certainly as it's been really, really hot and certainly very, very warm for some of our care homes, the guidance suggests that if you're going to use the fan, that you direct it to an open window.
That's great, thank you.
Great stuff. So colleagues are telling me that I have missed a question in the chat. Jonathan, would you like to say something?
I was just going to say, I think it might be from Helen Rains about Field Ed project.
It is. It's when is it open? You've told Ibra when his is open. So when's Helen getting Field Ed open?
So we're aiming for the same target date, at the latest, the end of October. Clearly, we've got to work on a number of buildings at the same time, and we've got limited resources. So I'll give you that as a drop dead date for the final result, but it could be earlier.
Right. So I think what we're saying then, Jonathan, is that our target to get all community facilities that we support open is by the end of October. Could we commit within the next couple of weeks to getting a slightly more indicative timetable for individuals or ones out, accepting obviously that resources might need to move around, so it's only indicative, it's not set in stone, and that perhaps could help colleagues like Helen and Ibra start to think about what they're doing. So Leslie's managed to get a question typed in. Well done, Leslie. I'm really pleased that we could answer it for you. And it's a question for you, Donna. It's about infection. Well, it's probably for Donna and Jenny. So if an infection is identified, so if there's a positive test result for somebody that has attended a particular centre, how long should they keep it closed?
It really depends on the number of affected, and if we've got a really accurate record of those on our track and trace documentation, we can work out what contact that positive case might have had with others, which will determine essentially whether or not we have to think about perhaps closing that setting for a period of time, and also would have to consider about people that needed to self-isolate as a result of having contact with that positive case. There are some really good action cards actually available from Public Health England that help guide people through an outbreak situation, which I'm sure we'll share after today's webinar.
Yeah, that'd be great. We'll point people at those, because actually it's really important from a reassurance perspective that you do that in the proper way. Jenny, is there any advice and guidance? And if you can come on mic, that'd be great. Is there any advice and guidance from a cleaning and caretaking perspective on top of what Donna's said that you'd like to add?
Yeah. Jenny Freer, head of venues, as Joanne said, and I also oversee cleaning within those venues. The virus generally doesn't last longer than 72 hours, so 72 hours closure should cover that. So in addition to Donna's comments, the building can be reopened as soon as it's been deep cleaned, and the recommended chemical is Kirklees, which is a chlorine-based product, but every item would need to be cleaned, so it's quite a deep clean. Underneath chairs, legs, tables, door handles, quite a detailed clean. But as soon as that clean's been completed, the building can be reopened subject to the users isolating in line with Donna's guidance and advice.
Can I just check that then Jenny? So if you want to open it faster, subject to Donna's advice and guidance and the public health action cards, you'd have to do a deep clean. Is the alternative that you just leave your building for a few days and come back? Is that 72 hours? Is that what you're saying?
Yep, you can leave your building for 72 hours and then it's safe, but I would still advise that deep clean with that Kirklees chemical, because then that continues to kill the virus for a further 24 hours from anything that touches that.
Thanks, Jenny. That's really good to clarify, and I think probably it'd be really good. I know that you've issued some advice and guidance out to our school settings around that particular thing, and I think it'd be good if we could support the community venues by perhaps sharing that advice and guidance with them. And yep.
Joanne, can I just add, if we do the deep clean before the 72 hours is up, then all the cloths, the mop heads, need to be and bins emptied into the yellow waste, clinical waste bags, and not disposed of for 72 hours.
Yep, great. So if we can issue that advice alongside those action cards, that would be really good. And Lisa, you're saying, I can see that you're saying that actually the cards are really good.
Yep, I just discovered them today on an email from last week. I think it came out from TSL actually, and there's ones for all different settings as well. So I had a quick glance and they were very pictorial and clear and simple to follow.
Yeah, great stuff. And Leslie's asked a question. Oh, I don't know the answer to that, and I normally pride myself on knowing at least a little bit. So Jonathan, Donna, will an air purifier help if they've only got a couple of windows? Does an air purifier help? Don't think it's a COVID stripper, is it?
I've not come across anywhere that indicates that an air purifier might be beneficial.
Jonathan?
I think my comment will be, if that industry thought that it would help, they would have already marketed the product massively by now. So I doubt it, if I'm honest.
Yeah. So no, Leslie, sorry, we're not recommending that at all. And Helen's just saying thanks very much for coming back to her on the field head opening, Jonathan. And yeah, I think everybody's hoping to get little things back to normal before the clocks change on an evening. And she's wondering if it's possible to have some outdoor space access. So if you could just take that one away, that'd be great. And then Charlene's asked a question around, has any money been put aside to help community venues with these ongoing extra costs? So again, I'd point you at the third sector leaders and the grant funding and the organisations that they can budget you up with. There is a number of things there, and I would also point you at the business and economy director, and we'll get the Ange and colleagues' emails in for you to be able to contact people who can help you with things like business rates and help you with the discretionary grant funding and a whole host of other things. So I'm just going to check. I think that we have now asked everything, and I'm really glad those colleagues that were struggling to get the questions on were able to do so. Just before I wrap up, I'm just going to look at the panel. Is there anything you feel that you have wanted to say, or you feel that you'd like everybody to know? If there is, give me a wave. So on that basis, then it just remains for me to thank everybody. So thank you very much, Jill, Lisa, Jonathan, Donna, Jamie and Jenny for popping on as well. I'd also like to thank Olivia, Tamsin and Stephen, who do all the hard work of producing all this in the background that makes us look good. I would also like to just say, if you've got any further questions, please don't hesitate, and we'll monitor the chat for those over the next few hours into tomorrow morning, and we'll pick those up again. Thanks everybody for listening. Thank you for supporting our communities and keeping going throughout what is an unprecedented period. It is in everybody's vested interest that our communities survive and thrive and are stronger because of this. We will do another webinar, perhaps in another, just as it's starting to get into winter, to be able to support you again with some questions and things around that. So thank you very much for being with us tonight. Remember, take care, stay safe, and we live in really difficult times, so be kind to each other.